Signs of aortic regurgitation. The first one is Corrigan's pulse. Corrigan's pulse is also called as dancing carotids. You find this sign in carotid arteries. It is a rapid and forceful distension of arterial pulse with a quick collapse. So there will be rapid and forceful distension of carotid arteries in the systole, and there will be quick collapse of the pulse in the diastole. So the reason is that in the aortic regurgitation, there will be leakage of aortic valve. So there will be pooling of blood in the left ventricle. So in the systole, LV has to contract or eject much of the blood into the aorta. So there will be rapid and forceful distension of the carotid arteries because of the pushing of large volume of blood into the aorta. But as there is valve leakage, some amount of blood will come back into the LV during the diastole. So there will be sudden collapse of the carotid arteries in the diastole. So that is the Corrigan's pulse. If you find this same pattern in the peripheral arteries like brachial artery, then it is called as water hammer pulse. So Corrigan's pulse means it is observed in the carotid arteries, and it is also called as dancing carotids found in aortic regurgitation. The second sign is de-Musset sign. It is bobbing of head with each heartbeat. Third one is Muller's sign. Muller's sign is uvula pulsations, visible pulsations of the uvula. Fourth one is Quincke's sign. It is capillary pulsation seen on light compression of the nail bed. If you compress the nail bed slightly, then you can feel the capillary pulsations. It is called as Quincke's sign. Then Traube's sign, also called as pistol shots. It is systolic and diastolic sounds that are heard over femoral artery. Derozier's sign is gradual pressure over femoral artery will lead to systolic and diastolic bruit. Will lead to audible systolic and diastolic bruit. Hill's sign is whenever the popliteal systolic blood pressure it exceeds the brachial artery blood pressure by more than or equal to 60 millimeters of mercury, then we say that it is Hill's sign. Shelley's sign is cervical pulsations, and hepatic liver pulsations means Rosenbach sign. And if it is splenic pulsations, that is called as Gerhard's sign. So liver pulsations is Rosenbach's, splenic pulsations is Gerhard's, also called as Sailor's sign, and cervical pulsations is Shelley. Uvula pulsations is a Muller's sign. And retinal arterioles pulsations, visible pulsations of retinal arterioles is Becker's sign. Menace is decrease in the diastolic BP by 15 millimeters of mercury when the arm is raised above the head. This is not that significant. But we need to remember this. It is a Menace sign, decrease in diastolic BP by 15 millimeters of mercury when arm is held above the head. The next one is Landolfi's sign. Landolfi's sign is systolic contraction and diastolic dilatation of the pupils. So these three are the 13 important signs of aortic regurgitation.